Hello friends, Jeanice Mitchell, pelvic health physical therapist. So you just had a baby and you're terrified about your pelvic floor. You're not sure what you should be doing, what you shouldn't be doing, or where to even start. I hope that these 10 tips for the early postpartum pelvic floor will help get you started. I have a lot of exciting animations and graphics here that I hope that you will find helpful. And then also in the YouTube captions, I will link these different handouts and resources and videos that I'm referring to. So I know this presentation has a lot of information, but I'm going to give you links so that you can further investigate and get more additional information after this is over. Before we get started, just remember that I am a physical therapist, but I'm not your physical therapist. This is not individual medical healthcare information for you, and it does not replace evaluation by a qualified healthcare provider. Here we have some red flags, and if you have any of these red flags, I strongly encourage you to follow up with your birth provider or your other healthcare provider. Number 1, unexplained bleeding or pain. Number 2, trauma. 3, we have fever. 4, chills. 5, night sweats. 6, unexplained weight loss. 7, unexplained weight gain. 8, altered mental status. So that basically means you're kind of confused. You're not oriented to person, place, and time. And then depression or suicidal thoughts, and that's a really big one in the postpartum period. All right, so let's talk about the pelvic floor muscles. We are looking at the pelvic floor here. Here is this person, they're lying on their back with their knees bent, and we are looking at the pelvic floor like we were at their feet looking into their bottom. Okay, so let's talk about the pelvic floor muscles and a little bit of the anatomy before we go into the pelvic floor tips. So here is a person, and the first view that we're going to look at for the pelvic floor, she's lying on her back and we are like at her feet and we're looking into her bottom. So this next image that you're going to see is of her pelvic floor right there. Okay, so here are the pelvic floor muscles, and you can see there are multiple muscles and several layers. A lot of times people think, oh, it's just one little Kegel muscle. Not the case. There are multiple muscles that make up the pelvic floor. Depending on how you count, there are at least 17 different muscles. So let's go over the anatomy just a little bit here. These are her thighs and her knees and her thighs. And then this is the pubic bone, that's the clitoris. That yellow little opening is the urethra, that's where urine comes out. The pink opening there, that's the vaginal opening. And then the brownish one here, that's the anus. And then here is the tailbone. So you can see all of these pink striated structures here are pelvic floor muscles. So they attach at the front and go all the way to the back, and then they also go side to side. So let's watch this contraction again. So you can see when the pelvic floor contracts, these openings, these canals close, and the organs lift. Let's watch that one more time. So the contraction happens, the canals close, the organs lift, and then when you relax, the organs lower, the muscles lower, and the canals open. We need to have both phases. All right, so the pelvic floor is affected by pregnancy. So here on the left, again, we have that female side view with the pubic bone here and the tailbone and the spine. These are the pelvic floor muscles. And then here on the right, here's the pubic bone, here's the tailbone, here are the pelvic floor muscles. But look at what the pelvic floor is now having to carry. So not only do you have the weight of the baby, you have all of the other extra fluids and so forth. So that pelvic floor, whether you have a vaginal delivery or a cesarean section delivery, that pelvic floor goes through a lot just in pregnancy with holding all that extra weight. Here's a nice nice infographic that I made to show what the pelvic floor does as the baby grows. And of course, this is a little bit exaggerated, but I think you get the picture. So up here, here's a very small baby. This is the pelvic bones, okay? And then this little net is your pelvic floor muscles. So your pelvic floor is kind of like this basket or this hammock at the base of your pelvis. And so this is the pelvic floor, and there you can see it's not very stretched. The baby is little. As the baby grows, the pelvic floor starts to stretch more and more. As the baby grows bigger, the pelvic floor gives more and more. And then look at that baby. So see the difference between small baby and big baby. Again, you're not going to feel this big balloon, but sometimes you might, during pregnancy, you might feel like you're just carrying that baby's head right on top of your pelvic floor. And if you even take your hand and kind of push up against your pelvis and your perineum, that sometimes feels really good and takes some of the pressure off. All right, so now let's talk about the pelvic floor muscles and delivery. So here we are again looking at the female bottom view. So we're looking at the pelvis from the feet. Here is the pubic bone. That's the vaginal, that's the urethra opening for urine to come out. That's the vaginal opening. And here are your pelvic floor muscles. And there's the baby starting to come down through the vaginal canal. And then here on the right, the baby is entering the vaginal canal and exiting the vaginal canal. And look at what happens there to the pelvic floor muscles. They are incredible because they have this very special ability to stretch. So as the baby exits the vaginal canal, different things can happen to the tissue that surrounds that vaginal canal. So here in this little sketch, this is a sketch of the perineum. So this would be the pubic bone and this would be the tailbone. Again, we're kind of looking at the perineum from that same angle. We're looking at it from below. And you can have different degrees of tears. So first, let's go over the anatomy. This is the urethral canal, that little yellow opening, and then here's the vaginal opening, and then here's the anus. And this smooth area of skin in between the vaginal opening and the anus is called the perineal body. And so when that baby exits, you can have tears happen at different places. So you can have tears happen in the perineal body. You can have tears that kind of go out to the side and even inside the vaginal canal. You can have tears that go up towards the urethra and even all the way up towards the clitoris. And then there's something else called episiotomies, which is a surgical incision made to facilitate the safe exit of the baby. And so usually episiotomies now will be out to the side to help protect that anus. So basically, this is a grade 1 or a first-degree tear, and it's a fairly superficial tear. The pelvic floor muscles aren't involved with this. This is a grade 2, a second degree. And here, the pelvic floor muscles are actually torn. And grade 2s or second degrees can extend even further out, but this is one example of a grade 2. And then a grade 3 is definitely the pelvic floor muscles are torn deeper into those muscles and that fascia layer, and it goes all the way to the anus. And then a grade 4 goes all the way into the anus and the rectal canal. Let's talk about that stretch again. Okay, so the pelvic floor muscles have the ability to stretch between 1.62 to 3.78 times their resting length. So think about your bicep muscle, and if you took that bicep muscle and you stretched it almost 4 times its length, what would happen to that muscle? Well, it would likely rupture before it even got close to being 4 times its length. So again, our pelvic floor muscles are very, very special. Most of the recovery of that stretch and everything that the pelvic floor muscles went through occurs within the first 6 months after delivery. And then by 12 months, the pelvic floor muscles are resembling the pelvic floor muscles immediately after C-section. Okay, so remember, pelvic floor muscles are affected even if you had a C-section. This is a very important concept because a lot of the tips that I'm going to give you kind of feed into this concept. So the forces from below must equal or exceed the forces from above, or the organs will fall. So let's go over the anatomy again. Here's the pelvis, like the pelvic bones. Here, this mesh, this is the pelvic floor muscles, that's the bladder, that's the uterus, and that's the rectum. And so you have forces from above, like gravity, and something we call intra-abdominal pressure, and you have the weight of the organs, and you have the weight of everything that's inside the organs. All of that is pushing down on that pelvic floor. However, nicely, we have some forces from above that can help to counteract those forces. But again, just imagining these forces and imagining everything that your pelvic floor muscles went through. I'm going to go off track just a slight bit, but I wish that I had been told some of these tips immediately after the birth of my first, or the birth of my second, or even the birth of my third. And I didn't get any of these tips. And so it's my mission to help educate you and empower you with information to help protect your pelvic floor, to help it to have time to recover, and to help it recover as fully as possible, and for you to live your best life. Here's a little video that I made. So again, this little rim, these are the pelvic bones, this is the pelvic floor, and we're dropping these organs on the pelvic floor. So remember, we have forces from above, and then here's one example of a force from below. So we're lifting that pelvic floor and those organs, we're lifting it from below. Let's jump into our tips. So I have 10 pelvic floor tips for you. The first one is push versus carry. So what does that mean? Basically, I'm encouraging you, especially in the first few weeks postpartum, to push the baby instead of carrying the baby, to push the diaper bag instead of carrying the diaper bag, to push whatever your toddler instead of carrying your toddler. Remember that basket of your pelvic floor muscles that's holding these organs, and those pelvic floor muscles just went through a lot with pregnancy, labor, and delivery, like you saw there. And so we want to help protect. And whenever you are carrying, that inherently puts pressure on the pelvic floor. Now, some people can take the pressure and no problems. Some people feel like they can take the pressure, no problems immediately, but they may experience issues down the road. And then some people, you're listening to your body, you hear your body's sending the right signals, and you're saying, this is too heavy for me to lift right now. But the bottom line here is just in the first few weeks, push as much as you can versus carrying. And hopefully you have people around that can help you. So this is not the time to show your superpowers about how much you can lift and how much you can do and how strong you are. Let's allow your body time to heal and recover. The second tip is gently squeeze. Okay, so here is what a pelvic floor contraction looks like from below. Again, we are looking at the pelvis, we're at the feet, and we're looking into the bottom. Here is the pubic bone and the tailbone, that's the clitoris, the urethra for urine to exit, the vaginal canal, and the anus. Let's watch that again. So when you squeeze, our goal here is for those pelvic floor muscles to kind of lift and pull up and in. The concern is that many people, when they're squeezing, or when they think that they're squeezing, they're actually not. They're actually pushing or straining out, or they're squeezing other muscle groups. And so it's very, very important to understand how to do a correct pelvic floor muscle contraction before you start practicing doing that. And that's what I'm here for, to give you tips. There's 4 key principles to pelvic floor muscle training. The first principle is to correctly contract, like we just talked about and like we just saw. The second principle is to completely let go, and I have an animation that I'm going to share with you shortly. The third principle is to be active at the right times. So we want those pelvic floor muscles to squeeze those openings closed so that urine or gas or bowel movement doesn't leak out at the wrong time, right? But on the flip side, we need those pelvic floor muscles to relax at the right time so that when you're on the toilet, you can pee easily and the poop comes out easily. You're not having to bear down or strain. There's 4 key jobs. So we just went over the 4 key principles. Now let's go over the 4 key jobs. The first job is to support. So remember, this is the side view. And when those pelvic floor muscles contract, those organs lift. Basically, the job here is to support the organs and the organ content and any pressure that is coming from above. All right. Second job here is called sphincteric. So basically here you have the bladder, and that's the bladder outlet. Here are the pelvic floor muscles that wrap around the bladder outlet. And then here you have the urine coming out. And so the pelvic floor muscles are letting go and urine is exiting. And so hopefully this happens when you want it to, when you're on the toilet. We don't want this to happen when you're coughing or sneezing or laughing or walking. The third job is sexual. So the pelvic floor muscles are active during sex and during orgasms. The pelvic floor muscles automatically, rhythmically contract. And so that's a pretty cool thing that our body does automatically, or that it's designed to do. On the flip side, the pelvic floor muscles need to be able to relax enough so that during penetration, so if you have your pelvic floor muscles right here and they're tight and closed and you try to penetrate, it's going to be difficult, painful, and maybe impossible. So the pelvic floor muscles need to relax to allow that opening to open so that penetration and thrusting isn't painful. So it's a very delicate balance between tone and sensation on one side and between coordination and lengthening on the other side. And then lastly, here we have stability. So the pelvic floor muscles work with your other core muscles. So you have the diaphragm, the deep abdominal muscles, the deep low back muscles, and then the pelvic floor. And it creates kind of this canister or an internal girdle to help keep everything in its right place and to keep movement controlled and stable. There are quite a few mistakes that happen with pelvic floor muscle training. So I want you to be aware of some of these mistakes so that as you're practicing pelvic floor muscle training, you don't make these same mistakes. Okay. And this is an infographic link that I will share in the captions. And I'm also planning to make a whole video just on mistakes, but we'll cover it briefly right now. Number 1 is holding your breath. So many people hold their breath. In fact, I think 99 out of 100 people, when I first start teaching them to contract their pelvic floor, they're holding their breath. Not integrating strength and endurance training. So sometimes we think of, oh, just a little Kegel, I'm just gonna squeeze, 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 right? But we're not getting a good strength training. So if you're at the gym and you're trying to get your bicep to bulk up, are you gonna do just little baby contractions? No, you're gonna lift and you're gonna squeeze and you're really trying to build up the bulk and that strength in that muscle. And then also with endurance. So again, a lot of times we just think, oh, a little Kegel, squeeze, squeeze, squeeze. But we want to work on endurance too. So squeeze and hold and breathe. Can you do that? And how long can you do that? Choosing the wrong starting position. And we'll go over some of the some of this here in a few slides, but basically if your pelvic floor muscles, if you just gave birth and they're very stretched out and weak and they've had a lot of trauma happen to them, this is not the time to be trying to do some hardcore training positions like in a deep squat or, you know, running and these kinds of things. Gravity assisted is basically where you take that pelvis and you're kind of tilting it up so that gravity can help the pelvic floor. It kind of puts that basket or that hammock on slack, and it's a lot easier to contract the pelvic floor muscles in that position. So if you've tried lying down regularly or sitting or standing and you're not getting a good contraction, you might try gravity assisted to see if that makes a difference. Squeezing accessory muscles when trying to isolate. So what does that mean? Basically, many times people squeeze their inner thigh muscles or they squeeze their glute muscles. So here's my Barbie. They might squeeze their inner thigh, they might squeeze their glutes, they may squeeze their belly muscles. Sometimes I even have people squeezing their hands and curling their toes. So there's a variety of compensations that you can do, but we're trying, when we start off with pelvic floor muscle training, we want to isolate and just squeeze the pelvic floor, not completely letting go. Again, this is a very common mistake. So many times people think, ooh, I need to squeeze all the time. So let's imagine that your pelvic floor is like your hand. And so your hand needs to be able to lengthen and stretch out, right? But it also, when we want it to work, either to make a fist or carry something or to write, we want it to do the right thing at the right time. And if we had that hand clenched in a fist all day long, even if you just clenched your fist for 10 or 15 seconds, when you go to open it, it's going to be a little stiff. The blood flow in there is reduced. The fascia and the muscles can get shortened and tight. The joints can get stiff. And then sometimes there can even be nerve compression. So we need to learn to completely let go. And I think this is going to be a whole nother video on itself as well. Only working on quick squeezes. So we talked a little bit about that with the strength and endurance training, but basically we need to work on the other aspects of the pelvic floor. So coordination, endurance, and power. Pushing down instead of pulling up and in. So remember that animation that I showed you. So when the pelvic floor muscles squeeze, it lifts up and those openings close. And that's what we want to happen. Let me just give you a little warning. Like if you take a mirror, which I encourage you to do, take a mirror and look at your pelvic floor and check it out. You're not going to see what I just showed you on the animation, because that animation is just raw muscles. It doesn't have any of the skin on top, right? And it's a little bit of an exaggeration as well for learning and educational purposes. So you probably won't see your vaginal canal close and tighten like this, especially if you just had a baby. I think a very good landmark to look at is your anus. So kind of separate your butt cheeks and look at your anus. And when you squeeze, is that anus kind of puckering up and in? Or is it opening and coming towards the mirror? And you want it to pucker up and in when you're squeezing, and then when you relax, you want it to open and kind of lower. And then assuming that you're squeezing correctly, like we talked about earlier, so many people do pelvic floor muscle contractions incorrectly. And so making sure that you get the tools and the knowledge and the education that you need to do it correctly before you start is important. This is a handout that is available on our website, mypfm.com. So it goes over some of the things that we just talked about. So 6 common mistakes and then how to correct them. So this is available for you to download. You can keep a digital copy or you can have a printed copy. If you're a provider or a professional, you can share this with other people. But basically, this is a really, I think, an easy way to kind of understand some of the common mistakes and then how to fix them. All right, so now on to our next tip, which is breathing and releasing. I cannot tell you how important it is to breathe. Take some deep belly breaths throughout your day. Even try to intentionally schedule in a few every hour. So much of your time is spent trying to do everything correctly for the baby. And then if you have other people in the house, other children, a partner, other family, you know, there's so many things going on, and your stress level is likely like right here. And so remembering to breathe, remembering to release, and here is what it looks like to relax your pelvic floor muscles. So again, this is exaggerated, and this doesn't have the layer of skin on it. So if you look at your own pelvic floor, you're not going to see this. But using that anus as a landmark is, I think, one of the easiest ways to connect. And so when you squeeze, that anus puckers up and in. But when you relax, like she's doing here, that anus is kind of opening and relaxing. Now, again, it's not going to open like, see a big hole like that, most likely, unless you had some kind of trauma. But you'll see it pucker up and in, and then see it kind of relax and open. The next tip is healthy pee. Pee is urine. How does urine affect the pelvic floor? Well, now remember, we have the bladder and the bladder outlet. So the bladder holds urine. That's what its job is. It's meant to fill. So as you're drinking throughout the day, that bladder, if you can envision it kind of like a water balloon. So it's slowly filling and expanding and getting bigger. And then when you choose to go to the bathroom, you empty the bladder and the urine comes out. And it has to go right through that urethral canal that the pelvic floor muscles wrap around. Here are some common mistakes that happen with urination, and then some common tips to help correct them. I'm not going to go over all of these right now. I will link this in the captions, and this is also going to be its own video, but I think it's important for you to understand that your urinary habits can affect your pelvic floor, and so it's important to have healthy urine. And to have healthy urine, you need to stay hydrated. So make sure you're drinking the right amount of water. Let's just go over a few of the mistakes here. So straining or holding your breath. We want to let go and relax the pelvic floor muscles. Stopping and starting urination. Let urine flow out in one solid, steady stream. Rushing urgently to the bathroom. Urinate when and where you choose. Going less than 3 hours or more than 4 hours between visits. And this is a general guide, so that doesn't mean that if you went to the bathroom at 2 hours that you have automatic bladder problems, or if you held it 5 hours one time that you're hurting your bladder. But these are habits that we develop. And I see people in the clinic, sometimes they're going to the bathroom every 10 or 15 minutes. Well, what kind of life is that? If you're going to the bathroom 4 or 5 times an hour, that bathroom is really ruling your life. And how are you going to go out and go to the grocery store or go to a movie or do any kind of leisure or work activities if you're going to the bathroom that much? It's going to completely limit the function of your life. And then on the flip side, I see some people that are waiting 7 or 8 hours in between going to the bathroom. And frequently these are people, I see a lot of active duty military, also a lot of teachers and nurses and other providers, that you're that caregiver person, and you're putting your own needs second to everybody else around you, but you're actually potentially doing harm to your bladder, because the bladder is meant to empty and it can get overstretched, and there are other problems that can happen with that, which again I think is another video. Okay, mistake, going more than once during the night. So during pregnancy, it's okay to go to a couple times a night, and that's considered normal. But now that you've had your baby, you want to go back into a cycle of just going 0 to 1 time a night. And when I say this, if you're up already because you're breastfeeding or you're bottle feeding the baby or whatever, if you're up already, it's okay to go to the bathroom again during the night. Just kind of keep in mind these 3 to 4 hours. That's your target time frame. Go going more than once during the night. So it's okay to go more than once. Up to twice is considered normal during pregnancy or if you're over 65. But you just had a baby, because here you are and we're doing the early postpartum tips. And so you may have been in a habit of going regularly throughout the night. And that's okay. That baby may have been pushing on the bladder and it made you more comfortable to go during the night. But now baby is here and let's get you onto a regular cycle. I see some people that are going 7, 8, 9, 10 times a night. What kind of sleep is that? How are they getting quality rest if they're getting up that often to go to the bathroom? Well, the answer is they're not. And so this is a word of caution that you want to train your bladder. Empty the bladder before you go to bed. Maybe don't stock up, don't super hydrate, right before you go to bed, and then try to sleep through the night or get up once during the night to urinate. All that being said, you have a baby to care for. All right, and so how is it bad to go to the bathroom if you're already up with a baby? It's not. So if you get up to feed the baby and you need to go to the bathroom and it's going to make you more comfortable to go back to sleep, go to the bathroom. I'm not worried about that. But it's these habits and letting the bladder kind of rule your life, and then you get into this bad cycle. And then here we have allowing urine to become concentrated. Many people think, oh, well, I had a little bit of leakage. By the way, leakage postpartum in the first few weeks is completely normal. So don't freak out if you're having a little bit of urine leakage. However, if it persists, we want to get intervention. And I think that's another whole video. But if you have any questions, feel free to reach out to me. But basically, allowing urine to become concentrated can actually increase that urinary urgency that you feel, and it's going to make you want to go to the bathroom even more. So stay hydrated so your urine is healthy. The next tip is short walks. Now, I am not advocating going on a 5K walk or doing an hour or two, but get out of the house. If you can do it 5 or 10 or 15 minutes every day, that's ideal to start off with. So it's good for your mind. It's good for your lungs and your heart. It's good for your body. It's good for your baby, and it's good for your pelvic floor. So you may have to go very slow, and that's okay, but you're moving, and movement is very good. You've got to balance it though. So I'm going to give you some tips. Like if you feel a lot of pelvic heaviness or pressure, go slow, and you may want to consider some external support to help lift that basket from below. And she's wearing heels. So please don't wear heels on your walk or heeled boots either. They're very cute and pink, but go towards some more comfortable shoes over here. Orgasms. Okay, so this is a fun one. And I imagine you're thinking, I just had a baby. I'm not allowed to have sex yet. So let's talk about sex and orgasms. Number 1, you can have orgasms without penetrative sex. And on the flip side, you can have penetrative sex without having an orgasm. When those two overlap, woo, that's wonderful. But right now, you're not in this category. You have not been cleared to have penetrative sex by your birth provider. So you need to wait to have anything penetrating in your vagina until your birth provider clears you for penetrative sex. That being said, that doesn't mean that you can't have orgasms. Remember where the clitoris is? It's on the outside there, kind of by your pubic bone, right under your pubic bone. And over 70% of females need clitoral stimulation to achieve orgasm. So it's highly likely that you can achieve an orgasm with clitoral stimulation now. Do you want to? Now that's another matter. It's up to you. But let's go over some of the wonderful benefits of orgasms. So, it's a pelvic floor muscle workout, and it's an automatic involuntary one. Remember what I said about orgasms at the beginning, that when you have an orgasm, the pelvic floor muscles are automatically, rhythmically contracting. So that's fabulous. Another example or another benefit of orgasms is that it's like a car wash for the pelvic floor. So that orgasm is bringing all that nice fresh blood to the area, and then it's leaving. So it's a nice circulation that's going on there. So that's what car wash means. It can improve your mood. It's a nice butt workout sometimes, but I would encourage you not to be vigorous. So you're still in the very gentle healing stages, but you can get your glutes engaged a little bit there. Sleep aid. So a lot of times after an orgasm, you feel dreamy and relaxed and you're able to go to sleep better. Partner intimacy. So let's just be real here. You can have an orgasm with or without a partner, correct? But if you want your partner to be engaged and help you have an orgasm in the first few weeks, wonderful. It might increase your intimacy and your connection and your communication there. It reduces stress. So orgasms, you just feel like the flood of stress leaving and you feel peace and calm. So you might need that right now. Heart workout is good for your heart, and then it also increases blood flow. With all of this, I'm not giving you medical advice. This is, again, just information, and if you have any concerns, check with your healthcare provider. Now, this next one, pelvis above the heart. Remember what we talked about with the pelvic floor. And in this position, the pelvis is tilted. So you have gravity kind of helping that pelvic floor. It's like a basket and it's on slack here. This position can feel really good, or you can and you can put 1 or 2 pillows under your hips if you don't have a wedge. Now, I do want to caution you, when I posted this on Instagram, there was some dialogue that there used to be a recommendation that this position was to be avoided for postpartum people because of the possibility of a hemorrhage or the possibility of an air embolism. I haven't seen that in any clinical practice guidelines, and I haven't seen any adverse effects from this. But again, remember, check with your birth provider, check with your healthcare provider before you start any program, and just be on the safe side there. Then here we have gravity neutral. And then we have standing, squatting, and jumping. So this kind of goes from easiest to hardest. And then this is just a little bonus here. This is a complete inversion. I am absolutely not recommending that you do this anytime soon. It requires stability, it requires balance, it requires flexibility, but you can see how inverted that pelvis is in this position. And so sometimes we'll advance to these positions as we're advancing your pelvic floor muscle training program. Squirt versus wipe. So there were a lot of questions about this too. What does that mean? Okay, so you're on the toilet and you pee, or you're on the toilet and you poop. And most of the time, what we're used to doing is wrapping our hand in toilet tissue and then wiping the urethra. And remember, you're wiping front to back, or you're wiping the anus to get yourself clean. Well, if you just had a baby, remember what happened to your vaginal canal. Remember what happened to your perineum. If you had any perineal tears, or you had an episiotomy, or maybe you had other kinds of tears that went inside the vaginal canal or went up towards the urethra, you probably are not wanting a whole lot of friction on that area. That you might have stitches and it's still healing. And so I think this next little tip felt so good. So here's the pelvis, and here's a bottle of warm water, just tap water. And you're just gently squirting it on the outside to clean yourself. So remember, you're going front to back, And I would test the water like on your thigh first to make sure that it's not too hot. And sometimes I would use several bottles, and you're right over the toilet, so who cares? All the water is flowing into the toilet. And then after you're done with this, you may still want to take some toilet tissue and just gently pat dry. We're not wiping or being vigorous with anything, but if you like the feeling of being dry, then you might just want to tap your tissue dry. But this feels wonderful. Now, there is something else called a sitz bath, and so that's a standard recommendation for a lot of people postpartum, but I personally didn't like the sitz bath. I much preferred the peri bottle, and a lot of hospitals will give you a peri bottle to take home with you. But this bottle that I have is just, I think it was a salad dressing bottle. You know, you can get it at the grocery store, most grocery stores. So it's a great way to clean yourself, and honestly, I love how it feels, and just seeing this again makes me want to start cleaning myself this way right now, because it feels so good on your tissue, and especially on newly postpartum tissue. All right, soft poo. So going back again to what your body has been through with vaginal delivery or even a cesarean delivery, we want that poop to just slide out. We don't want to strain and spend time on the toilet and push. Think about what that pushing is doing to that pelvic floor. Not good. So here are some tips about how to have a soft poo, and I'll link this in the captions as well. 6 common mistakes, and again, I think this will be its own video at some point, but it takes time to create all of this, and I run out of time for all the ideas that are flowing through my mind. So don't hold your breath for the video. Ask me any questions that you have before then, and you can get this link down below in the YouTube captions. So 6 common mistakes: straining or holding your breath. We want to open your mouth, take a deep breath, and say grrr. Okay, so if there's air flowing through and it's a deeper, lower tone, your pelvic floor muscles are more likely to be relaxed. Ignoring the urge or putting it off until later. So many times we're busy and we think, oh yeah, I feel like I have to go, but I'm going to do that later, especially for our poops. We put our poops off way too long, and then sometimes we listen to our bladders too much and we get worried and over anxious with our bladders. So don't ignore that urge. Get into a regular cycle and go daily if at all possible. Mistake is having hard poop or rabbit pellets. We really want it to come out like a soft, squishy banana. Eating a lot of processed and constipating foods. And I know that it's tough postpartum, especially if you don't have someone there helping you with food prep and purchasing these good fresh things. But this is something that you can think about even in advance. And if you know of a postpartum person, you can help bring them some good fresh foods. And with all of the delivery options that we have now with COVID, at least in the USA, hopefully that makes getting some fresh food at your house a little easier. So eating whole foods with plenty of fiber. Mistake: clenching your pelvic floor muscles, anus, or knees. So we don't want to clench, we want to release and open, widen the knees. And then your posture. So squatting helps make poop easier. And then lastly, for our tips here, we have external support. External support gives a counter force from below. And I do have a video that I have on YouTube that you can click on the link that goes over a lot more detail and a lot more options. But basically, this is a device that would be worn over your underwear but under your outerwear, and it just lifts that perineum from below. There are many options, but here is again our little video that shows the pelvic floor muscles, the weight of these organs, and then how nice it feels to have some lift from below. And there's really no reason, like if you're if you're in the kitchen, you're doing things, and you're feeling a lot of pelvic pressure or heaviness, just take your hand and lift it up there. It's not very functional. You're not going to be able to walk around in that position, but it might give you some temporary relief. And then here are some other options that are available. All of these links are going to be in the caption for this video. It's called Pelvic Floor Muscle Training External Support. And so if you go to the YouTube video and you go to the captions, I'll have links for those. So let's say you do all these things and you're having bladder problems, or you're having bowel problems, or you're having pressure or vaginal bulging, or you're having pelvic pain or sexual concerns. Guess what? Pelvic therapy can help you. Pelvic physical therapy, that's exactly what we're here for. And so I want to encourage you not to wait 6 weeks, especially if you're in pain. So if you're in pain, there's no reason that we can't help you earlier. And so I encourage you to get connected with a pelvic physical therapist. You can find a pelvic physical therapist on our website, mypfm.com. We have links to 4 free searchable databases. Some of the databases have more pelvic physical therapists in the US, some have more global pelvic therapists. And if you have any problems or questions or difficulties finding one, direct message me, email me. That's what I'm here for. I love connecting people with other people and with content and information and resources to help you answer your questions and to help you live your best life. So in closing, remember our 10 tips. Remember that there is hope and help out there if you're having symptoms. My name is Jeanice Mitchell. Here is my email address. I'm on Instagram at My Pelvic Floor Muscles, or you can go to our website, mypfm.com. Thank you so much for joining me today. I hope this information was helpful, and I will see you another day. Take care. Bye-bye.